As the rainy months roll around, we must also keep ourselves educated about health and keeping our bodies in check. To celebrate this June's National Cancer Survivor Month, Lifeline is here to make a contribution by giving you a hand about what cancer is, what are the different diagnoses and treatments, and how do cancer survivors navigate their lives after treatment. I am Doc Rob, a medical biochemistry professor and general practitioner, welcoming you to today's episode of Lifeline, the show where we improve our lives by feeding our minds. Today, we're joined by our two lovely guest doctors. First is a radiation oncologist from the Benavides Cancer Institute and Cardinal Santos Medical Center. Let's welcome Dr. Ryan Agas.
Hi, thank you.
Welcome to the show, Doc. I believe that this isn't your first time po in Lifeline. Is that correct?
Yes, I think this is my third.
Okay. Welcome back to the Lifeline show, Doctor. Okay, so next, joining Dr. Ryan is not also a stranger in this show. He's a respected medical oncologist from the UST Hospital. Let's all welcome Dr. Eugenio Jean Emmanuel Regala. How are you, Doc?
I'm good.
That's
It's nice
good,
to be
Doc.
back.
Yes, welcome back also to the show, Dr. Jean. Okay, so for today's show, we'll be having Dr. Ryan and Dr. Jean answering questions with us. Okay, so I hope you're well po and happy that you're back no, to today's show. So now, as a fellow doctor myself, obviously I understand the means of your specialties. But for the viewers watching at home, can you please explain po to them, doctors, no, what it means no, in layman's term, what it means to be a radiation oncology doctor and what it means to be a medical oncology doctor. So let's start with Dr. Agas first.
Radiation oncologist. So treating cancer requires several specialties, several specialists. We have a surgeon, we have a medical oncologist, and a radiation oncologist. So my specialty deals with using radiation to target cancer cells. So we use specifically X-rays to treat cancer. So it's a targeted form of treatment. It's a local form of treatment.
Okay, so Doc Ryan was able to mention to us no that in treating cancers, meron tayong mga different types of treatments that we could employ no for use to our patients. Of course, pwedeng single treatment lang, pwedeng combinations of treatments depending on what type of cancer we're dealing with. So now, since we're done introducing si Doc Agas, no, let's now introduce si Dr. Jean Regala naman under medical oncology. So Doc, can you tell us po what a medical oncologist is?
Okay, a medical oncologist is a doctor that treats cancer patients and treats the patients with the different drugs. So we can give chemotherapy, immunotherapy, biological therapy, all the new treatment modalities as far as systemic management is concerned.
So I'm sure you guys are very excited to talk about today's topic. So first, we'll start off by asking questions. No, we'll be alternately asking questions to Doc Jean and Doc Ryan pertaining to cancer. Okay. All right. So let's start with Doc Jean for the first question po. Doc Jean, what is cancer? How do we define it?
So essentially, cancer is a term used to denote disease, which is essentially brought about by uncontrolled growth and proliferation of cells, which essentially would form a tumor. And these tumors will have the tendency to spread locally, or it has a tendency to spread to the other parts of the body.
All right. So basically, cancer is somewhat a tricky thing, no? It can start as simple as a small cell, then it can differentiate or divide into many cells after, and it can grow. Okay, so Doc Jean, I have a follow-up question po. With June being considered as National Cancer Survivor Month, what do you think is the goal of this celebration or month?
So Basically, it's to spread awareness as far as the truth from the time of diagnosis as well as treatment. So it's essentially to give everyone an idea of what a cancer patient will have to go through from, as I said, diagnosis to management. And also, it will basically increase the awareness of patients as far as the signs, the symptoms of cancer, so that they will be encouraged to seek early consultation with their respective doctors should they develop any symptoms that are possibly cancer.
Okay, so more of a more than a celebration, no? Kasi sometimes I associate the term celebration with a happy event or thing. I think June is better termed to as an awareness month, no? Cancer awareness month. This is the month where we honor, no, and give information, no, for our cancer patients and to the lay people regarding what cancer is. Okay, thank you po, Doc Jean, for answering that question. Okay, so for my next question po, let's move to Dr. Ryan. Okay, Doc Ryan, how prevalent is cancer in the Philippines, especially in your field?
Well, that would depend on several factors, on the type of cancer, the sex of the patient, the region that it's more prevalent in Manila, in NCR. And of late, we've been seeing a higher number of cancer patients. But if we look at the data in the cancer registry, I think the number is around 150 to 200 in 100,000 Filipinos are afflicted or diagnosed with cancer.
Right. Thank you po, Doc Ryan. So, based from Dr. Ryan's answer, no, we can see variations depending, of course, on several factors. Siyempre, papasok na dyan yung mga risk factors ng patients, no, yung mga demographics natin, the sex, biological sex of a patient, their lifestyle, of course, more importantly, and many more. Okay. So, thank you po, Doc Ryan, again, for that answer. So, for our third question po, let's move back to Dr. Jean. As a medical oncologist, what are the common ways to diagnose cancer? And can you enumerate and describe a few po to us?
So, to make a diagnosis of cancer, one, we first have a quote unquote a clinical diagnosis, which essentially means that when a patient goes to the clinic with a lump, so for example, a breast mass. So when they do go to our clinics for consultation, we do a complete history, physical examination, and if all the data would basically coincide with the diagnosis of cancer, then breast cancer, then we would label this as a clinical diagnosis. Then the next step is to subject the patient to a histopathologic diagnosis. So we refer the patient to our friends for a biopsy, and then the specimen is sent over to pathology. And once the histopathologic diagnosis is confirmed, then the patient is labeled as really having cancer. After which, the patients will have to go through staging. So they will be subjected to different diagnostic modalities in order to be able to arrive at the exact stage of the patient. And this will basically be our basis on how we will treat the patient depending upon the stage.
Okay. So, nabanggit po sa atin ni Dr. Jean, no, yung parang scheme na sinusunod namin as medical doctors. In medicine, we were actually taught that as soon as we encounter patients in our clinics, we first start by getting information from our patient through history taking, which is actually the most important part, no, of the patient checkup. So, history taking first, yung parang kwentuhan lang, no, nagtatanong tayo sa mga patients natin. And then, we go to the physical examination part. So, kanina nabanggit ni Doc G yung pag may lump, kunwari si patient, we apply physical examination by inspecting the lump, no, palpating, checking its size, etc., and other characteristics. Then, after those history and physical examination, nabanggit din ni Doc Jean sa atin na important na mag-request ng mga necessary laboratory tests or diagnostic tests, which can, of course, confirm, no, our diagnosis or clinical diagnosis for our patients. So, that's a very lengthy process, no, na pinagdadaanan natin as medical doctors and patients. So, Doc Jean, follow up po. Based on your experience and observations, how accessible are these diagnostic processes in the Philippines?
So, in the National Capital Region and the other big cities of our country, like Cebu, Davao, the diagnostic modalities such as MRI, PET scan are readily available. However, for the other areas, of course, they will have to send their patients to these big cities in order to be able to come up, in order to be able to have those tests done. Furthermore, there are other tests that are needed in order to allow the physician to be able to tailor fit specific treatments for patients, such as genetic testing, biomarker testing. These tests are not available readily in the provinces, unfortunately. So again, they have to send their patients over to Metro Manila or Metro Cebu, Metro Davao in order to have those tests done.
Actually, this question is parang pinapakita sa atin no, yung reality in the Philippines regarding the medical field in general na parang sa provinces po usually kulang ang resources po natin no as compared to the big cities like NCR. So ayun nasagot kanina ni Doc Jean no na maraming mga diagnostic processes na usually available naman dito sa NCR pero hindi available sa mga far-flung areas here in our country. And I think that also highlights one of the main problems that we have in our country when it comes to healthcare. So hopefully in the future, ma-address to ng mga people no in the government most especially. Okay, so next question po to Doc Ryan. Okay, so as a radiation oncologist, can you tell us more about radiation therapy and treating cancer?
So I think I'll just expound a little bit more on what I said a while ago. So as a radiation oncologist, again we treat cancers with radiation. So as I mentioned, we use X-rays to target the tumor. These are X-rays that are more powerful, higher in energy. They can damage or kill cancer cells. And these are targeted specifically to the tumor and at the areas at risk near the tumor or the areas that where recurrence might occur. No? So that's how we do radiation therapy, and we give it in several conventional radiotherapy. We give it in daily sessions, what we call fractions. So it's usually around 28 to around 35 fractions total.
Alright, so napakagandang field din no kung nasaan si Doc Ryan ngayon. When I was still a kid, parang the problem then was that cancer doesn't have any modes of treatment yet. But as I was growing older, entering med school, parang with the advent of technological advancements as well, there came the rising of yung radiation oncology as one of the fields no in treating cancer. So, napakagandang field kasi parang dati hindi natin alam kung saan ba dapat hahanapin yung certain types of cancer, no? Pero ngayon, kaya na pala natin silang i-target at i-treat na din kung saan sila nakikita. And among those, no, in those field would be the radiation oncologists. Okay, so for my next question po, doctor, so this question is addressed to the both of you po. So I will start with Doc Jean muna po this time, then Doc Ryan. Okay, so for this question po, in the spirit of Cancer Survivor Month, what advice can you give to non-patients in spreading awareness on cancer survivorship? So let's start with Doc Jean.
So the diagnosis of cancer does not mean it's a death sentence. So it's important to know the signs, the symptoms. It's important also to go and consult your doctor if you have any symptoms that you are feeling or if you are unsure of, in order to catch the diagnosis early if and when it is cancer at all. And as we say, no, early detection is better than cure.
Okay, then we get the answer naman from Doc Ryan.
Actually, I have the exact same thoughts as Dr. Regala. As Dr. Regala mentioned, cancer is not a death sentence, and that's why we have cancer survivors. So you need to approach the appropriate team of professionals, of specialists to help you reach that goal of cure. Yeah.
Thank you po, doctors, for your answer, no? And of course, to our family members, no, yung mga friends natin, na merong mga kasamahang may cancer or cancer survivors, of course, it would be very important to have a social support system na malalapitan ng mga cancer patients natin if everyday have physical or mental health problems, no? Dapat nandyan tayo parati sa kanila. And as we doctors emphasize in med school, we don't just treat patients when it comes to their physical health, but treat health as a whole spectrum of not just physical, but also social, mental, spiritual, psychological health. So dapat lahat yon, no, na tatakil natin. And it's not just a one-man team, no, na doctor lang parati ang lalapitan ng pasyente. Siyempre, ang unang line na malalapitan ng pasyente ay ang kanilang mga pamilya, mga kaibigan. So dapat lagi tayong compassionate, ready, no, to lend a hand sa kanila pagdating ng mga panahong yon. Okay? So thank you po, doctors, for answering the first set of questions that we have for Lifeline. So thank you po, Doc Regala and Doc Agas, for giving us wonderful insights about cancer and for the advice on what we can do in celebration of the National Cancer Survivor Month. Now, for our next segment, we'll be having a round of mythical operations. So this is a segment of the show where we dissect facts from misinformation. So basically, Doc, parang magbabasa lang po ako ng mga statements here. Then, sasabihin po natin, no, kung sila po ba ay mga facts or myths, no? And these statements will be related to our topic for today, which is on cancer. Okay? So, fellow doctors, are you ready for this segment?
Yes.
Yes, okay. Sige po, let's go. Let's begin with Dr. Ryan. Let's start. For the first statement, cancer survivors cannot be a blood nor organ donor.
Actually, that's both a fact and a myth. That depends on the type of cancer the patient has, the type of organ involved, the type of what the patient is going to be giving. Is it blood? Is it an organ? What's the status of the cancer? Has the cancer already metastasized? How far out is the patient from treatment? And what's the status of the cancer? I think I think there are some patients, some cancer patients actually can donate, but it depends on those factors.
Okay, thank you, Doc Ryan. No, nabanggit ni Doc Ryan yung term na metastasize sa atin. So metastasize is actually in layman's term yung kumalat na, no, yung cancer ni patient. So may mga times kasi na nagkaroon ka ng cancer, let's say in one organ. Pero when it metastasizes, it will also spread to the other organs in our body. So of course, that could also be a criteria, no, that we can look at kapag nag-organ donation or blood donation tayo. So thank you po, Doc Ryan, for that. Okay, so for our next statement, addressed to Dr. Jean naman po, cancer survivors have a lower chance of contracting another cancer. Is this a fact or myth?
It's neither a fact nor a myth. Patients who have cancers can develop secondary cancers depending upon several factors. One is genetics. So a patient can develop a second malignancy that is totally unrelated to the first malignancy this patient may have had. If the patient has bad genes, then they can develop second malignancies. The treatment modalities that the patients have received can also produce second malignancies. So it's not a fact nor a myth.
It actually varies po, no,
Depends,
Doc?
yeah.
Lots of factors, genetics most especially play a role in there. Okay, so thank you po, Doc Jean. Okay, for our next statement, again, let's go back to Doc Ryan. The side effects for cancer treatment are permanent. Is this a fact or myth?
This question, this statement is also, the answer to this is also varied. So that depends. We have what we call acute or early side effects. So these are side effects that occur while on treatment or shortly after treatment, and most of these are temporary. But we also have the late toxicities, late side effects. So these are side effects that come out or occur a few months after treatment, and most of these are usually more permanent.
Okay. Thank you po, doctors. Actually, even though I graduated from med already, no, I still have a lot of things to know about cancers, neoplasms, no. So, thank you din po for enlightening me no, with your answers for today's questions. And that ends our segment no, for mythical operations. Thank you so much, Doc, for debunking the misconceptions relating to cancer survivors. But don't go away just yet because when we come back, we'll be hearing more from our guests as we dive deeper on Cancer Survivor Month and how survivors navigate their lives after treatment. Only here on Lifeline.
We are happy to be part of this global activity of spreading awareness against cancer. UST Hospital, together with the Thomasian community, is working together to educate our medical staff and patients to contribute in making this world a cancer-free place. Through this effort, may we promote healthy lifestyle, enhance awareness among Filipino people, and make a mark in reducing the global impact of cancer. We salute the men and women who continuously fight to survive and win this battle against cancer. Together, let's close the gap in the treatment of cancer care.
The will to live is a natural desire for all human persons, especially those who are battling diseases just like cancer. The whole Thomasian community, especially the University of Santo Tomas Hospital, through its Benavides Cancer Institute, commits itself in its fight against cancer. Together as Thomasians, let us support those people who have dedicated their lives in terms of their research and study about cancer. Let us hope and pray for cancer patients that they might have renewed faith and hope that their health may be restored and that happiness may reign in their families. God bless us all.
And we're back. Earlier, we tackled the general questions surrounding cancer and the misconceptions about cancer survivors, together with Dr. Agas and Dr. Regala. Now, doctors, for the second part of our show, we'll tackle more on cancer survivorship. And of course, the celebrated Cancer Survivor Month. Are you still up and ready to answer more questions, doctors?
Yes, yes.
Okay, thank you po. All right, so without further delay, I think we should start now with the next set of questions that we prepared for Doc Regala and Doc Agas. So let's start with Doc Jean for this next set. So first question, Dr. Jean, what are the common side effects do cancer survivors go through after seeking treatment?
It will actually depend on what was given. So if the patients were given chemotherapy, the most common side effects would be weakness, loss of appetite, and some of these patients could develop nausea, vomiting. But with the advent of the newer medications, we see less of these side effects, particularly with the medications that we give together with the chemotherapeutic agents. For the other agents that we give, such as the targeted agents, they could develop diarrhea, they could develop rashes, they could develop hand-foot syndromes, and sometimes for patients who receive immunotherapy, they can develop endocrinological problems such as hypothyroidism, hyperthyroidism, and pneumonitis. And these are just, of course, to name a few.
Thank you, Doc Jean. Actually po, no, when we were studying this in BS Pharmacy back then, or in pharmacology more specifically, I think the most common thing that cancer patients experience as side effects would be nausea and vomiting, no? Laging nahihilo, nanghihina, tas nasusuka. kaya po lagi din natin silang binibigyan ng mga gamot, no, to combat those side effects as well. And Doc Jean also mentioned, no, a few side effects aside from nausea and vomiting, which are also, no, experienced by our patients seeking treatment. Okay, so for follow-up question po, Doc Jean, do these aforementioned side effects pose a hindrance in their everyday lives?
For the older drugs, it may pose a hindrance for their daily activities. But then again, we're already in the era of more targeted forms of treatment, and therefore the side effects are now a lot easier to manage. So we see less and less of these side effects that I mentioned, particularly with chemotherapy.
Thank you po, Doc. Actually, when you're experiencing side effects with medications, no, it's also one of the things that hinder patient compliance in following up for checkups or following up for treatments, no? Kaya minsan may mga patients tayo na hindi na bumabalik kasi pagod na silang ma-experience yung mga side effects din po ng mga gamot na ito. So, Doc Jean mentioned to us that these side effects, they can be managed, no? And right now, in the advent of technology, we also see yung mga targeted treatments na nabanggit ni Doc Agas and Doc Jean also. So, because of those, nababawasan na din yung mga side effects na na-experience ng patients natin. Okay? So, now, we proceed to the next question po to Dr. Ryan. Okay? Based on your experiences, Doc, with your patients, do you believe that hope and having a positive mindset plays a significant role in their treatment process?
Yeah, definitely. I think it plays a significant role. That's why one of our roles as the physician of the patients is to help them go to that place wherein they're more positive, reasonably positive, because it depends on, again, with the prognosis of the patient. So you don't want to give false hopes to the patient. But in general, patients who are more positive with their diagnosis, they are able to cope better, not only with the diagnosis but with the treatments, the side effects, long-term side effects of treatment, and the outcome of the treatment.
Yes, very nice answer from Dr. Agas, no? Diyan na din natin makikita na kapag isa kang doktor, hindi lang dapat puro brains ang ginagamit natin. We should also employ the heart, no? Be a doctor with compassion. Okay? Parang doctor na may puso para sa kapwa niya. Okay? Now, we proceed to the next question for Dr. Jean. Okay? As this is a month beyond just awareness, how can a simple person actively help in celebrating advocacies like this one?
So there are a lot of lay fora, support groups. So actually a lot of people can join so that they will learn more about the patient's journey. And there are many ways to help a patient who is diagnosed with cancer. And also, as I mentioned, they will learn a lot so that they can share it to their own family members, particularly those patients who have or people who have a very strong family history for cancer. So by joining these support groups and lay fora, they will be able to help disseminate truths about cancer and at the same time awareness.
So dyan na rin po papasok yung no, Doc Jean, na treating patients is not just a one-man team, na it's not just the doctor who's helping you. You should also be able to help yourself, no? You should also be able to seek help from the people around you. Okay? So now, going back to Dr. Ryan, from your knowledge, how does the UST Hospital contribute for this Cancer Survivor Month?
I think not just for this month. I think the hospital, specifically the Benavides Cancer Institute, has programs for cancer survivors whole year round. We have what we call our CanShare group, which is as in line with what Dr. Regala mentioned, it's a support group for our cancer survivors. So these, I think, if I'm not mistaken, the CanShare group meets at least quarterly or even more often than that to help, again, the patients who are survivors.
That's nice to hear po, no, Doc Ryan. So, meron pwedeng lapitan yung mga pasyente natin kapag nagkakaroon sila ng mga ganitong conditions. Okay, so now for my last question po, doctors. So this is addressed po to the both of you again. So this question goes, do you have any words of wisdom to share with our viewers who know someone who has battled cancer or are the ones battling it themselves? So this time we start with Doc Jean.
So, as I mentioned, with advances in technology as well as the understanding of cancer, it's not a death sentence. So, the main thing that we should do is go seek early medical consultation so that your chances of getting cured will be much higher.
Okay, now let's hear it from Doc Ryan naman.
I don't think I'm old enough to give words of wisdom, but yeah, to just to add to what Dr. Regala discussed, I think the most important thing is to seek immediate help from the appropriate professional. And as I mentioned, it's not just a single specialist that you need to seek. It's usually a team of oncologists that we work really.
Thank you very much po for your insights and answers, doctors. So thank you to Dr. Agas and Dr. Regala for answering our questions. I'm sure our viewers learned a lot from your perspectives. And I sure do hope that you also enjoyed your time here with us at Lifeline, just as much as we enjoyed having you here today po. Though June is the National Cancer Survivors Month, in our hearts, we give out appreciation and respect to cancer survivors everywhere all year round. Always feel the roar by following us on our Facebook, Instagram, TikTok, X, and YouTube page at UST Tiger TV and at UST Tiger Radio. And I myself am also on social media. Follow my journey in becoming a heart surgeon. That's at Robert Katz, AAA, TZ. Once again, I am Doc Rob, your host for today's episode of Lifeline, where we improve our lives by feeding our minds.